like me in a bit more detail. Just want to highlight some of the background research around participating in online communities. Lots of health-related online communities have been studied. So your reading is on chronic pain bloggers. So there's been blogging, tweeting, Instagram, Facebook, forum use, quite a wide range of different forums that have been studied in different ways. And to a certain extent, I think the jury's still out on the level of impact, the variance between different illnesses, what sort of determines whether it has a positive or negative impact on people. But there are a range of positive findings which it's worth being aware of. These primarily relate to psychosocial components of living with illness or disease. So we get things like improved levels of emotional well-being, improved perceived control of disease, feelings of personal empowerment. People learn more about their conditions, so improved medical knowledge. They might exchange resources and communication with others and develop a sense of relatedness with other participants. There's less clear evidence that people's conditions actually improve. That would be much, much harder to assess in a controlled manner. So you can see that mostly what's been studied are the sorts of things that you can ask patients to self-report, and really that self-report is what would be measured in, say, a randomized controlled trial or something that's a bit more rigorous in terms of its data collection. So now we'll move on and have a look at patients like me. So as you saw in the video and the first clip, it was set up by a group of brothers when one was diagnosed with ALS. And the major challenge for people diagnosed with chronic, severe or fatal disease is often a lack of access to people with similar experiences. Doctors aren't necessarily very good at helping a person make sense of their illness, come to terms with their diagnosis, and even living on a day-to-day basis is not really the realm of expertise of a specialist medical doctor. What doctors are expert in is monitoring and diagnosing disease, tracking progression and symptoms, and prescribing approved drugs. Those are really important, and I'm not suggesting we need to get rid of those or they should be taken away, but there's much, much more to living with a chronic or severe illness, and particularly one that's known to be fatal, than these factors. So there's more to living with disease and trying to live as well as you can with disease than what healthcare professionals are often able to provide in the current context. Patients Like Me was founded in 2006, so it's been around for a while now, and it's quite a radical shift in how healthcare, personal health data is normally managed. So as you'll be aware, your health information that's generated by your interactions with the health system is private. You can access it. Healthcare professionals who you choose to see or who you get referred to can access it, and beyond that there's very, very limited access to your health data. Patients Like Me flips this on its head pretty much entirely by creating a platform for patients to choose to share their personal health data, so they upload it, and they also get to share their experiences of a particular disease, and they basically create health or illness communities where this data is shared amongst those who share the same diagnosis. And so the sorts of things that get included on patient profiles, I guess this is a bit like having a Facebook profile, but specific to having a disease. Your health data, how many years you've been diagnosed, the age at which you're diagnosed, gender, the symptoms you experience, the progression of the disease, the medicines you've used, ones you've tried and maybe discarded, your personal biography, and a lot of this data is presented visually to enhance interpretability, because this isn't being presented for doctors, it's being presented for people living with the disease. And so all the information that you need to upload is then basically creates a profile, and other people can view your profile and potentially engage with you, ask you what you're doing, what your experiences have been, and of course you can do the same for them. So just like on Facebook, you can search, you can browse, you can post to groups, either forums, you can post public comments to particular people and send them private messages. The key question, and what we're going to look at in the next clip, is how do patients interact with each other when they have access to each other's medical records?